Good morning, everybody.
Morning.
Looks like we've got a few more people logging in, and then we'll go ahead and get started in just a moment here. Okay, let's go ahead and get started. I'm sure we'll have people continue to log in, but I just want to give us as much time as possible. Welcome to RADT 3423. This is federal regulations. My name is Taylor Ward, and I'm the instructor for this course, and I'm really looking forward to having you all in class this semester. To start off, I do just want to do some introductions. There are some of you that I do know, some of you that I don't. So I'd just like each of us to introduce ourselves and just tell me which program you're in and something interesting about yourself. So starting off, I'll go with me first. So as I said, my name's Taylor Ward. I'm in my 5th year teaching here at Weber State. My specialties are CT and MRI. And something unique about me is that I love to run marathons. So since your screens are all a little bit different, probably, I'm just going to go ahead and just call off your names, and then you'll have you introduce yourself. Let's start with Hillary.
My name's Hillary, and I'm in the Nuke Med program. I live in Idaho, and I snowboard.
You snowboard?
Yeah.
Awesome. What part of Idaho are you in?
Right now I'm in Twin Falls, but I'm from the Boise area.
Oh, very cool.
Yeah.
Awesome. Thank you, Hillary. Ben.
Yeah, I'm Ben Skinner. I'm in the Nuke Med program. Live in Wyoming, and let's see, I've just barely started flying drones, so different kind of imaging, but very fun.
That's really cool. I bet you get some really cool scenery out there.
Yeah, it's been beautiful. When it's warm enough to fly, I'm too scared when it's this cold. Yeah.
Yeah, I'm sure. What is it out there right now? I bet it's freezing.
Today's a nice day. Today's around 32, just around freezing, but it's been like negative 15 at my house lately.
Wow.
Yeah.
Wow, I'm glad you're having a nice day today at least.
Right, yeah.
Great, thank you, Ben. Felicity. We're just introducing ourselves and something about like which program you're in and something unique about you.
My name is Felicity. I'm in the Advanced Rad Science program, and I love to dance. So I also teach dance. So.
Awesome, that's super cool. Thank you, Felicity. Lords, please correct me if I pronounce that wrong.
Oh, it's fine. Or it's Lourdes or Lords. It goes either way.
Okay.
I live in Dayton, Nevada, which is east of Reno or east of Tahoe.
Very cool.
I am a rad tech, and I'm in the nuclear med program. And I guess hiking would be something unique. I love to hike.
Very cool. I'm sure you have a lot of cool places to hike there.
Yes, beautiful places.
That's awesome. Thank you. So it's
You're
Lourdes?
welcome. Lourdes, yeah.
Okay, thank you.
Thank you.
Ian.
Hi, my name is Ian. I am in the nuclear medicine program, and I swim often competitively.
Very cool. What events do you do?
100 butterfly.
Butterfly. That's super cool. Thank you, Ian. Amber.
So I'm Amber. I live in Salt Lake, and I like to sing and play the piano.
Very cool. And which program are you in?
Oh, hopefully the mammography. They haven't officially accepted me yet, but hopefully.
Oh, okay. Very cool. Thank you. Debbie.
Hi, I'm Debbie. I live in Sun Valley, Idaho. My specialties are CT, mammo, and X-ray, and I'm in the Nuke Med program. And something unique is that my hobby job is that I build homes with my husband.
That's super cool. And you've got a lot of skills under your belt too, it sounds like.
Yeah, I've been around a little while.
That's awesome. Never hurts to have more skills. It makes you valuable.
Nope.
Great, thank you. Nicole.
Hi there, I'm Nicole. I am in the Advanced Radiologic Sciences program, just getting the bachelor's. And something unique about me is that I am a musician. I play the piano, guitar, and the viola.
Wow. That's a lot of instruments to be able to play. That's impressive. Very cool. Thank you, Nicole. Alexia.
Hi, you can call me Lexi. I'm in the Advanced Red Side program. I'm from West Haven and I like to sew.
Awesome. Thank you, Lexi. Maria.
Good morning, everybody. I'm Maria. I'm in Advanced Radiology Science Bachelor's program. Something unique, I'm from the Andes, from Ecuador. Yeah.
That's fantastic. Thank you. Chris.
Hi, I'm Chris. I'm in Durango, Colorado, and I am in the Nuke Med program. And I guess something to know about me is that I spend most of my free time running and skiing.
Very cool. That's awesome. Durango's a cool place. Kyra or Kira.
It's Kira. Technically I'm still in the X-ray program, but I'm trying to get into the advanced program this semester. So I kind of snuck in. And something cool about me is I have a 1-year-old. She's really fun.
Oh, that's so fun. Great, thank you. Okay, I don't think did I miss anybody? We've got everybody here that's here. Okay, so before we get started on the lecture part of today, I do want to go over the Canvas course and the syllabus and answer any questions that you may have there. As of right now, we're planning on having the classes on Zoom. I do much prefer to have it in person, but there are a lot of extra precautions that are still in place right now. So if it does change to where we can get to face-to-face, then we will, but you would be notified. You'd have enough advance notice to plan for that, and the date and time for the class won't change. So we'll just plan to have those on Zoom, and then unless something changes and we're able to get you here on campus, we would let you know of that well in advance. Let me share my screen here. And this is the Canvas course. So I hope most of you have been able to get on here and take a look already. I know some of you have already put some questions into the syllabus discussion, and that's great. You'll see that the course is set up here in Canvas week by week. So it has items that I want you to be going over and doing each week. You're certainly welcome to work ahead. You know, there's a lot of these things that doesn't take a whole lot of time to go through, so you can work ahead if you'd like. But you'll see that, you know, last week was the first official week of the semester. So I have the syllabus up here. Any options, you don't have to put in the syllabus questions. It's not worth any points for your grade. But if you had any questions about the syllabus or anything before we had class today, I left that as an option. And then you'll see that week by week, there's different items. So this week, we're covering the lecture for section 1. So I have the PowerPoint here that I want you to review. It's just a resource for you to be able to go back and look at here. And then next week is the first discussion. You'll see that most weeks there are discussions. And I'll kind of show you what this looks like. So this first discussion, I have a link to an article, and I want you to go ahead and read the article, and then you're going to post an initial response And the initial response should be thorough. I want several sentences, what your reaction or what your thoughts are from reading the article. And your initial response is worth 30 points, so that's worth the most points on these discussions. And then I want you to respond to at least 2 of your peers. So 2 other people in the class, respond to their responses, and those are worth 10 points each. So those I also want to be somewhat thorough. I don't want you to just say, yes, I agree, or good point. It needs to be a little bit more than that. I want it to be a discussion. I think this will be a great way to give you some insight as to things that are going on currently in current regulations and changes in regulations and things that are relevant now. And it will give you an opportunity to, communicate with your classmates a little bit more, especially since we don't have those in-person classes. So each of those, it's going to be an article or a video, some type of a prompt, and you'll do the same thing for each of those discussions where you do an initial response and then you respond to at least 2 of your classmates. Because you have to respond to at least 2 of your classmates' posts, you need to make sure that you respond early enough, because if you're all waiting until the last day that this is due, then it's going to be hard if you're just waiting for each other to post. So just make sure that you post at least a couple days, if not more, before the due date so that you have enough time to respond to others as well. So let's go ahead and look at the syllabus before we go any further. So this is located on the first page when you go to the home page on Canvas in the first module. It's also located in files here on Canvas. So if you wanted to go find it there, you're welcome to download it, or you can just keep it on here as a resource. My contact information is here. The best way to get a hold of me is definitely by email. I can get back to you much quicker. And if you would like to set up a Zoom or a phone call, I'm more than happy to do that. Just email me and we'll set up a date and a time that works for both of us so that we can address whatever questions or issues you may be having. But email is the quickest way to get a hold of me. And please make sure that when you email me that you mention that it's the 3423 class. That'll just help me to be able to get an answer to you quicker. The schedule, so we have the Thursdays at 8 a.m. for the 4 different class sessions, which I have listed here for the specialty weeks. And if you're here in class, you already know this, but the Zoom links are here under Canvas. So if you click the Zoom, all the links for each class session are located there. I do plan to record these class sessions, but I do want some interaction. I want you to attend. I prefer that you are here in class because it gives you the opportunity to ask questions and it gives us better class discussions and overall better class sessions. But if for some reason you aren't able to attend, I will plan to be posting, I will post the videos from these Zoom sessions. They'll be located under files, and I'll also put them under the week that we have that class. So it should be easy to find those videos and you can watch them again if needed. One thing I do want to add, a little disclaimer, is that with the recordings, this has only happened like once or twice, but every once in a while the recording, after recording a video session, it doesn't convert and it doesn't work, or it won't let me upload it to Canvas. So in those types of cases, I can't guarantee that the recording is going to be available. So that's another reason that I really encourage that you attend and be here in class because I can't guarantee that those recordings will work. As I said, that's a rare occurrence for most Zoom sessions, and I've done a lot now, as I'm sure you all have too, since the pandemic started. Most of them work and it's not a problem. My policy for assignments and turning in things, my late policy, is that if it's turned in late, it will automatically be deducted 50%, and then it will not be accepted after 2 weeks. So make sure that you are on time. This course is set up so you have plenty of time to work on these items, so it should not be an issue. Just make sure that you are staying on top of it and working on things as you go. But that is my policy. So if it's late, it's automatically deducted 50% and then 0 points after 2 weeks. This course does not have any examinations. So I will show you the setup of the assignments. We've already talked about the discussions and what I expect from those. The other assignment that you'll be doing is objectives, and those are listed here in the syllabus. So I'll show you where those are at. And then the grade will be calculated as follows. So each set of objectives for each section of the course is worth 150 points each, and then each of the discussions are worth 50 points. And so your grade will be calculated as a percentage of how many points you earned, and then how many were available, and that will be calculated as a percentage. And then this is the grade scale that will be used. Just remember that for our program, a grade C or higher is the minimum to be considered passing. So this is the week by week schedule. This is the same as what you see on the week by week in the Canvas homepage, but this is the due date. So they're always due by Sunday, that Sunday night at 11:59 p.m. So on these weeks where you're just reviewing the PowerPoint, there's nothing you need to actually submit, but I do want you to start working on the objectives for section 1 and make sure that you are reviewing the PowerPoint, or at least that you attended class and we went through it together. And then each week, if you have a discussion, that's due by that Sunday by 11:59 p.m. And that's for all your posts, so the initial and your posts for your peers. Those all need to be submitted by the due date. And then you'll see that the first set of objectives are due by February 21st. And then you'll start working on the next section. Spring break is March 8th through the 12th, and so on and so forth. So these are the objectives. You'll see that there's a set of objectives for each section. And this is material that I expect you to learn, and it's important for you to learn. And so what you will do is you'll write out the number and the question for each of these questions, and then you will answer each question. It should be in your own words. I don't want any plagiarism. I don't want any copying and pasting. I want it to be in your own words. And you're going to answer the question minimum of 3 to 5 sentences. Just make sure it is thorough. And you also need to cite where you obtain your information. And I want you to do that in APA format. So you should have a citation with each question. And then at the end of each objective assignment, you'll have a list of references list of all the references that you used to find your answers. You probably noticed that there is not a textbook that's required for this class. And that's because a lot of these regulations are managed on online websites through government agencies and regulatory agencies, and they get updated quite often. It's hard to have a textbook that is up to date, especially by the time it goes through editing and publishing and then finally gets out and available for purchase. It's already out of date. So this course is set up so that it's more of an internet search course. I want to aid you in being able to locate where these regulations are, where to find them, which agencies cover certain types of regulations, and locating those. And then you'll kind of see a lot of that through the articles and discussions that we go through as well. So these are items that the objectives you can type in a Word document. And that's what I recommend doing, because then you can save it as you go, as you start working on it, and then you'll upload that document in Canvas by the due date. So you'll see here that section 1, it's broken into different subsections. So OSHA got 10 questions, personal safety and education has 14, or it goes to 14, 11 to 14, ionizing radiation. Following each set of objectives, I have learning experiences here. So these are here to aid you in finding the answers to a lot of these objectives. So I've given you some keywords when you're doing internet searches. I've given you some key things to look up. And I also have some notes in here that some of these answers are things that you could look at your own protocols at your hospitals to find. So this is something that you'll be having to search a lot of different sources to find the answers. And then it will be the same format for section 2, 3, 4. Now, there are some of these questions where it says review or discuss. And if it seems like it's a little confusing on how to answer that, I just want, especially for the ones that say review a certain thing, I would prefer that you just put a few sentences displaying how, showing me that you understand that concept and that you found information on that and citing where you found that information. So for example, this one says review the requirements, NCRP requirements regarding radiation therapy equipment for equipment design and facility design. So that's where I'd want you to talk about, okay, what is the equipment design? What requirements does the NCRP have in place for equipment and facility designs? So a few sentences for each of those. All right, so and then the same thing, you'll have the learning experiences that give you examples of things to look for in your keywords when you're doing your searches, and the same format for sections 3 and 4. So any questions on the syllabus and what we've gone over today, what those assignments look like?
For the reference page, does it need to be in APA format as well?
Yes, please. Okay. Please do APA format. Thank you, that's a great question. All right, so going back to the home page, as I said, so since this week is technically week 2 of the semester, I will post this video recording here under week 2. It'll also be located in the files tab here. And I would recommend that this week, it would be pretty easy for you to look at the first discussion and start contributing to that, and then working through each of those. So let's see. I think that was everything that I wanted to cover here. So you'll see that here we've got the discussion articles in the files tab. I also have the syllabus here, each of the PowerPoints, and then I'll create a folder after today's class session that just says Zoom recordings, and that's where you can find those class sessions as well. Okay, any other questions? Okay. I know you're probably not thinking that federal regulations is the most exciting topic, but I try my best, especially I think those discussions really bring a lot of information to light that maybe you haven't, some topics that you haven't thought about before that are pretty relevant. Okay, so now I'm going to switch screens and we'll just roll right into the section 1 lecture. This goes along with what you'll be doing for those objectives for section 1. So to start off, we've kind of already talked about this today, but the goals for this course is I want you to become familiar with what the regulations are, and specifically for the workplace and even more specifically, radiologic sciences. So regulations in regards to radiation safety, things that are in place in our environment as medical imaging professionals. You're also going to learn about OSHA and other regulatory agencies, and you'll find a lot of support in that. Become familiar with specific hospital regulations, and you'll find that this may vary based off of your facility that you are working at. These can vary from facility to facility. And I want you to be able to look at that and compare what the hospital regulations look like and compare that to the federal regulations. And again, this is an internet search because I want you to find and learn how to find the most current and up-to-date policies. This is something that's going to be valuable for you in your careers later on because you never know when a manager may ask you to say, hey, what is the policy for this? Or maybe you are the manager and you need to update policies at your hospital to be in alignment with federal policies. So that's a good skill to have and good knowledge to understand where to go, what agencies control what, and having that at least base knowledge moving forward. So let's start with OSHA. OSHA is the Occupational Safety and Health Act. This was in 1970. We're going to talk about that a little bit more in detail. We'll also talk about the 1991 Bloodborne Pathogen Standard, the Needle Stick Safety and Prevention Act, which was effective in 2001. Maybe a little bit crazy to think about that it wasn't until 2001 that they actually had this in place for needle stick safety. We'll talk about standard precautions, exposure control plans, federal requirements for hepatitis immunizations, latex allergies, tuberculosis enforcement, and the Safe Medical Devices Act. So OSHA, this was in 1970. And basically what this did was it set and enforced protective standards for those working in certain environments. So when you're working at any type of workplace, there's going to be certain safety plans in place to protect employees in that certain environment. And this varies from workplace to workplace because certain occupations will have different types of risks associated with that workplace. So OSHA basically identifies what those risks are in the workplace and then sets standards in place to protect the health and safety of the employees in those various workplaces. In 1991, we got the bloodborne pathogen standard, and this was to help prevent occupational exposure or protect from occupational exposure of HPV, HIV, and other bloodborne pathogens. And along with that, we got the Needle Stick Safety and Prevention Act, which was basically an add-on. It was signed into law in November of 2000, but it wasn't effective until 2001. So this is not just bloodborne exposure, but specifically in regards to needle sticks. So it wasn't enforceable on its own. It has to be enforced through the Occupational Safety and Health Act. So it's basically an addendum to the OSHA Act. So OSHA has several requirements, very generally broken down. We have the standard precautions and then an exposure control plan. You're probably very familiar with these, especially even more so because of the COVID pandemic. There's been a lot more emphasis on hand hygiene and PPE. These are things that we already are very good about, I believe, for the most part, in the healthcare environment because we see so many different diseases and pathogens, but even more so now. It's been even more of an issue with this pandemic. Other things like respiratory hygiene, certain types of masks, PPE, injection practices, how to keep things sterile. For example, in the OR, when you're doing procedures, how to make sure that things stay sterile to prevent infection. And then also the cleaning and disinfecting of different surfaces. Now, an exposure control plan, this is something that does need to be in writing, and it has to state what the purpose is of that exposure control plan, has to define the terms. So it has to say, okay, what does exposure mean? What does pathogen mean? What do all these terms mean? And then it will state who's responsible. So, you know, the managers are responsible for this, and the administration is responsible for this, and the employee who's exposed is responsible to do this. So all these things in the case of a certain type of exposure. This also involves assessing the risks associated with that workplace environment. So for example, sharps containers, so that gives you that risk of a needle stick and getting a bloodborne pathogen exposure. So those things need to be laid out and assessed. And then there needs to be a plan for how to keep people compliant and keep people safe. This involves training. This is usually done when employees first come to a facility. They learn how to follow those procedures and how to protect themselves. But it also should involve regular training and updates so that all employees are current on what's expected. And this exposure control plan does need to be verified annually. So that way it stays up to date and current to the current exposure risks of that facility. So the bloodborne pathogen standard does require that employees who are exposed to bloodborne pathogens have to have a hepatitis B 3-shot vaccine series. And this is something that should be offered to an employee by the employer within 10 days of being employed by that employer. And this should not cost the employee anything. That's something that the employer is responsible to provide to any employee that needs it. Latex gloves cause allergies for a lot of healthcare workers, especially when they're wearing gloves all the time. And we started to first see this in the 1970s. About 8 to 12% of healthcare workers do have this sensitivity or allergy to latex. Just curious, because it does vary a little bit, but what are the hospital policies where you are at? for latex gloves?
I know our hospital doesn't use latex.
None at all?
Nope.
We
Awesome.
We use the
The same?
the latest surgical gloves, and if the patient has allergies, they just use the sterile nitrile, I think.
Mm-hmm.
But those are the only ones latex that we use. And then the regular standard percussion gloves, they are just the blue ones, the nitrile, I think.
Great. Thank you. Anybody else? Is anyone allergic to latex themselves? Anyone have this issue? No.
No, but since I've been around for a while, we used to have latex gloves everywhere. And I would see coworkers who would develop latex allergies from wearing the gloves all the time.
Mm-hmm. Yeah, not fun, because then you don't realize how much latex is in other things too. Not just the gloves, just balloons even. You know, like I have an aunt who has this latex allergy because she was a nurse and she worked with it all the time. And, you know, birthday parties, she's like, I can't be around the balloons because of the latex. So it's definitely a real thing and something to keep in consideration. And I think that a lot of healthcare workers, as Amber had mentioned, a lot of them have just taken it out altogether, where there aren't latex gloves available anymore to help reduce that risk. But then, as Maria had mentioned, there are some things that are used in surgical units that have latex. So it's very important to check for those allergies for patients before you start a surgery so that you avoid giving the patient an allergic reaction during surgery. Thank you. All right, tuberculosis. This, as you probably know, and I hope you already know, is airborne. And if you have a patient or an individual that is undiagnosed and they are untreated, they can actually infect 10 to 14 people in a year. This typically is associated with populations that have lower socioeconomic status. Some racial or ethnic minorities are at higher risk. Those that are co-infected with HIV, AIDS, that are immunosuppressed basically, are more likely to develop this. They're just higher risk. Foreign-born persons and those who work or reside in institutional or congregate settings where there's very close contact, people living together in those types of environments, it just increases the risk of tuberculosis. So what are your protocols? If you have an employee that is exposed to TB during work? Do you know? So that's something maybe you'll want to do in the coming weeks, is see what your policies are if you were to get exposed to a patient that has active TB. Sometimes they'll treat you. Sometimes they will just have you do a TB test or do a chest x-ray to make sure that you haven't developed the TB. But one thing that you probably have all done is that most employers are going to require that any new employee or even new students that come into that environment, they have to have a TB test to verify that they haven't been exposed or have been infected, or a chest x-ray. So some people that have been exposed, their TB test will react. And so then they have to have a chest x-ray to verify that they don't have active TB before they can enter that hospital workplace. So you've probably all done that plenty of times getting into the hospital setting. Okay, the SMDA, this is the Safe Medical Devices Act. This became public law in 1990, and the law number is 102-629. This was from the FDA, and basically what this does is it's a regulation on medical devices because they want, when you think about devices, there's manufacturers and there's companies that want to make money. And so if there's not some regulations in place, it would be easy for employers to just not report incidents associated with their devices because they don't want to lose money on those devices or have their company look bad. So this really gives a good accountability to manufacturers and companies to make sure that their devices are safe and that they're not having a lot of errors. So what this does is it requires by the FDA that they report any error with devices if they've caused death or contributed to the death, caused serious injury, illness, or even if it just has a malfunction. Those all need to be reported because if you have a manufacturer that's sending these devices all throughout the country, maybe you just have one here, one malfunction here. But when you put it all together, it allows you to look at any patterns associated with that device and say, hey, this is having too many problems. This is not considered safe. Let's take this off the market. So this is something that is required by the manufacturers, and they have to submit reports to the FDA annually for these devices. The personal safety education and training. Again, you've probably already done this. Anytime you go to a new facility as a new employee or even as a student, you have orientation. So this is proper training and education that tells you what the risks are associated with this work environment, with that specific job. And honestly, the new employees are the ones that are at the most risk because they're not as familiar with the environment. They're not as familiar with the protocols. So it is so important that new employees get this education right from the get-go. I really like this quote, and that's why I've put it in here from OSHA, that no person should ever have to be injured, become ill, or die for a paycheck. And I think that really epitomizes OSHA's mission to protect employees in the workplace. Again, this is also something that should, and I know that it usually feels like a pain if your employer makes you do this on a yearly basis, but it is so important that employees are able to access the information for how to protect themselves and the associated risks with their job. So some of these things include a disaster plan and a fire safety manual. The disaster plan will lay out several different types of disasters and what you are expected to do in each type of disaster. It must be kept in writing in the workplace and must be available for all employees to review. Now, in the past, these have been big binders that are somewhere in the department and they're written on paper. But I know that a lot of facilities have now moved to having these in like an online portal that all employees can access. Can you guys give me a little insight as to what your facilities do for this, if you know?
Ours still has the binder.
Awesome.
It's not very big, but it's like easy to flip through, but it's still a binder.
Right. Which I see nothing wrong with that. In my opinion, if the power goes out, I still want to know what's going to happen or what I need to do in a disaster. I think it's good to have it in writing too.
We have the online portal, but I think there's a few locations where they have those binders that you can reference them in that situation, like you said.
Awesome. Thank you. Yeah, so if you don't know where this is, make sure that you find out because you need to know what those disaster plans are and what you need to do in those situations. A little bit of a funny personal story. I lived down south for several years when I was going to grad school. And being from Utah, I had never encountered tornadoes. I think there's been one or two in my lifetime here in Utah, but it's so rare. It's not a regular thing. But down there, it happened quite a bit. So they had the safety officer come when I was a new employee and orally quiz me. So they came in person, sat me down and had, quizzed me on the different disasters and what I'm supposed to do in each situation. And, I had studied the tornado safety because that was so new to me. But then they asked me, so what do you do when it snows? And I kind of was surprised by that because, again, being from Utah, I've dealt with plenty of snow and they don't see snow there at all. And so I just was like, just drive slow down, be safe. And they're like, no, you wait at home until your employer calls you, until your boss or manager calls you and tells you it's safe to come in. Or you don't leave your work until you get approval to leave. And to me, that was just so foreign because I'm used to driving in the snow. But it just goes to show that it's very dependent on where you are geographically, what types of disasters are associated with those areas. And it's really important to know what those rules are based off of where you are, what your facility policies are. So I was like, well, that's no problem. I don't have any problem driving in the snow, but if you want me to wait, I will do that. So yeah, just make sure that you know what the policies are at your facility. And if you do get another job or move to another facility or move across the country somewhere else, that you are familiar with those policies. Now, because we are medical imaging professionals, we have to have a solid understanding of ionizing radiation and how to protect ourselves from that. So a lot of this should be a little bit of a review from when you were in the radiography program or when you were getting your X-ray training. Remember that there are genetic and somatic effects. So the genetic effects are those that can affect, the DNA, that can be passed on to future generations. And then somatic effects affect all other cells within the body. So they can have an effect on those types of cells. We also have the terms stochastic and non-stochastic radiation effects. We'll go over that on the next slide. You should all know the golden rule, ALARA, which is as low as reasonably achievable. So our goal is to get the highest quality image, the lowest possible dose to the patient. So we want to minimize dose, maximize quality. There are also federal regulations and international regulations that set maximum permissible doses for people that are in the general public versus occupational workers versus pregnant women, and all the different populations. There are maximum doses. They also have maximum doses for different parts of the body. So like the lens of the eye versus the skin. So those are in place. And here are some of the agencies that regulate and govern those dose requirements. So we have the NCRP, so that's the National Council on Radiation Protection. ICRP is the International Council. The environmental, so that's the EPA, federal, FDA, OSHA is the workplace, and then NRC is the Nuclear Radiation Commission, so that they do a lot of the research that then is taken and applied by these regulatory agencies. We also have the Consumer Patient Radiation Health and Safety Act of 1981, and that is in place to protect those that are working in the healthcare field and also to protect patients from the causes of radiation. So it is our responsibility as medical imaging professionals to not overdose our patients. So this should look familiar. I hope it does. So remember, the genetic versus somatic is what types of cells are affected. The stochastic versus non-stochastic. Stochastic means that it's non-deterministic. So basically, it's not predictable. You can't say any amount of radiation is considered safe because you don't know if it's going to have an effect later on down the road. Sometimes it won't, sometimes it will. It's random. It's not deterministic. So an example of that is cancer. And to describe stochastic effects, we look at this non-threshold linear response. So linear meaning that it's a straight line. So as you increase dose, that does increase the risk of having a response. And then threshold means that there's no space here before you have a risk of having a response. Now, if you have a threshold, as you do with number 2 here, see there's this much space. So until you reach this amount of dose, you're not going to see a response. So this describes the non-stochastic. These are deterministic effects. These are effects that we know that there's a threshold. So for example, 50 rads is a typical first threshold. And we know that once you hit this amount of dose, you're going to see hair loss. Once you hit this amount of dose, you're going to see cataracts. Once you hit this dose, you're going to see reddening of the skin, that erythema. So those are known and they are predictable. We know that once you hit certain dose thresholds, you're going to see certain effects. So that's what this threshold means. So maximum permissible doses, remember ALARA, this is the golden rule, as low as reasonably achievable. And these are the doses for the radiation worker, so 5 rems a year or 0.05 sieverts. Most places now go by the international standards, so they go by sieverts instead of the rems or rads. But you will see this when you start doing your internet searches and looking at these regulatory agencies, that you see these are very interchangeable. You'll be seeing both of these. So I do have them both listed here. The general population is 0.1 REMS per year, or 0.001 sieverts. This is an interesting thing though, because when you look at patients that are in diagnostic imaging, look at that maximum permissible dose, any amount needed to complete the study. And if you think about that, that's a little scary if you don't have responsible healthcare workers that are not practicing ALARA. Because we know that the more dose you have, the more likely that there is going to be a risk or have an effect. So it is important that even though the maximum permissible dose for a patient in diagnostic imaging is any amount to complete the study, we need to be aware of their doses. We need to be practicing ALARA. Now, pregnant RTs that are pregnant, the maximum permissible dose is 0.5, and this is if they declare their pregnancy. So employers cannot require that a pregnant RT declares their pregnancy. However, if an employee does not declare their pregnancy, then the employer is not responsible for providing a dose to monitor the fetal dose. So it's completely up to that employee if they want to declare the pregnancy. But if you do declare it, then it makes the employer responsible for making sure that you don't exceed those maximum doses for the fetus. All right, the Consumer Patient Radiation Health Safety Act of 1981. This was set from the Secretary of Health and Human Services. And this goes into educational programs. So it actually has requirements for an educational program to be accredited to make sure that those educational programs are providing students with knowledge and education related to radiation safety. It also helps to regulate the standards for the administration of radioactive technologies and treatments, which a lot of you in here are nuclear medicine students, so you're learning about that and are probably pretty familiar at this point with a lot of those standards that are in place to protect you and patients with those radioactive materials. And this also renders it unlawful to practice radiologic procedures by uncertified individuals. And unfortunately, a lot of people miss this. There are some states that don't require licensure. And so they have nurses or MAs that, you know, at certain clinics that they say, oh, well, I'm supervising you as a physician, so it's okay for you to take this x-ray. When in reality, it is considered to be unlawful. And those people that are not trained in a radiation safety program or just an accredited program for radiation, they don't know how to protect themselves. They don't know how to protect their patients. And so it really is a hazard for patients and for those employees. So that's something that is very, very important, that you are a certified individual or at least a student in an accredited program and you're learning those standards. Now, as you are going about the objectives for this first section, I want you to become familiar with the different agencies. You'll see here that I have listed that the NCRP and the ICRP, these are advisories. So they look at a lot of the research and then they advise the regulatory agencies on how to set certain standards. And these regulatory agencies include the NRC, EPA, FDA, OSHA. So these are the ones that have more power to say, this is what you need to do. These are the standards you need to follow, and that there are consequences if you don't follow those. All right, here are some of the references from today. Any questions on what we have covered today? Oh, I'm so sorry, I didn't realize there was a chat. So you have a binder and an online portal. Unfortunately, they aren't the same information. Oh, I'm sorry to hear that. So this is in regards to the safety sheets and the disaster plans. That's interesting that it's not the same information. They would not keep that consistent between the two. Do you believe that that's because maybe they just haven't updated the binder, or are they completely different? looks like Chris may have left. No, I don't think we have an answer for that. That's all right. Okay, any questions, comments, anything about the lecture or about the course expectations, the syllabus, discussions?
No, I might have missed it while I was taking notes, but that graph that you showed, you explained kind of 1 and 2. Was number 3 kind of radiation hormesis theory, or was that something different? Oh, was that? Okay.
Yeah, yeah. So that's where you see like it's kind of a gradual increase, and then it's like a high spike, and then either there's recovery or death. So it's just, that's why it kind of like stops and flattens out. Yeah, thanks. That's a great question. All right. Well, I know you probably have a long day of classes ahead of you, so we will finish up for today. I hope you get a chance to, get up and move and stretch before your next class. Please feel free to reach out to me if you have any questions or concerns. As I said, I'm more than happy to set up Zoom or phone calls if you need additional information or would like to chat about something in the class. Otherwise, email is definitely the quickest way to get a hold of me. I'm looking forward to a great semester, and I'm excited to go through those discussions throughout the semester and see what you all have to contribute. So stay safe out there, stay healthy, and we'll see you next time.
Thank you.
Mm-hmm.